Guys in their young 20s, how are you affording top surgery?
So in my case, I went through a center for LGBTQ plus people and they found me a surgeon who would accept my insurance. The place I would be getting it in is a little far, but can be reached with Uber or even public transport, which would take longer. I don't have a car, so traveling to the place is my only expense.
Story 2.
I was able to afford it at 18 because I went to a very cheap community college and applied for a ton of scholarships, so I got enough to pay for both school and surgery. I had also been saving money since I was 12, so that covered about $3,000. But to be honest, mine was luck combined with it being 2021, so I could use COVID higher education relief to pay for it.
Story 3.
I had top surgery when I was 22 without insurance. Insurance didn't cover gender-affirming care then, and the surgeon, cosmetic, didn't accept insurance anyway. I learned how to be really frugal and budget really well, and saved every penny I could for 4 years. I found a surgeon I could afford somewhat close to my area. It was still a 6-hour drive, to reduce travel expenses. I was in college, though, and had student loans to help cover some living expenses. It still took a while to save regardless. Back in the day before insurance covered top surgery, a lot of young guys used student loan money or took out a personal loan to cover part or all of it.
Story 4.
It was a combination of a lot of things, but I understand it came from a place of privilege. I got my first job when I was 14 and have been saving regularly ever since, but that's only because of my parents who 1, drove me everywhere before I could drive, 2, bought me a car, 3, paid for my degree, and 4, let me live with them rent-free until I graduated. I was able to save about $30,000 working summers in high school and part-time in college over the course of about 7 years, $15,000 of which went entirely into my surgery, but I wouldn't have been able to do that if not for my parents being such a financial help in the background. They didn't spend a penny on my actual surgery, but the only way I could afford surgery was because I wasn't paying a car note, insurance, rent, bills, etc.
Story 5.
I lived in NYC and used Medicaid. My insurance also partially covered travel, which helped a lot.
Story 6.
My friends helped me pay for it. Plus, I'm going to get my tits done in Mexico. My friends are also Mexican and offered to drive me there since they have a family nearby and can help me manage my shit without having to pay for travel expenses.
Story 7.
I used care credit to pay a surgeon who did informed consent. Got approved for $8,500, which is exactly how much my surgery cost. Now the monthly payments for it is around
Story 8.
24, Matasamir here. I'm really hoping insurance covers mine. I'm on my mum's insurance until 26, so I'm fighting hard to get it ASAP because I'm almost 25. I moved out at 19, but haven't actually been able to save anything because I've moved 4 times in the last few years and life keeps happening. Luckily, there are 2 surgeons within 1.5 hours of me who take my insurance. So I'm really hoping this works out, because to be honest, I'm not doing good mentally or physically.
Story 9.
I want bottom surgery, baby. Even if just histo. I have a plan of combining crowdfunding and hopefully a grant. I heard of some non-profit places that will chip in for surgery costs, so I hope 1 or 2 of them will help. I know it won't cover it 100%, so I'll be going back to penny pinching and eating 33-cent ramen.
Story 10.
Went to the healthcare.gov website during open enrollment and qualified for a health insurance subsidy to the point my insurance is $20 a month. Selected an insurance with a low out-of-pocket maximum, $600. My top surgery this year is basically free. If you don't have a job or you have a part-time job, it's actually pretty easy and affordable. If you or anyone else needs help, I can walk you through it.
Story 11.
In my country, it's free, but the waiting lists are a bit long, though it depends on the surgeon. I think in 1 to 2 years, I'll be able to get it. For the other expenses, like some appointments, renting a house for a week or month, and possibly a caretaker, I'll have to save some money for my job.
Story 12.
My dad dropped my insurance, and it was too expensive to get added to my mom's, so I had to apply for OHP. I haven't had my consultation yet, but I'm really hoping that OHP actually covers transitioning-related procedures. I also talked to every top surgeon in my area and had to change my insurance type / coverage to work with the one doctor who actually accepts my insurance. Not gonna lie, I got pretty lucky with my situation.
Story 13.
I was 26, almost 2 years ago, when I had mine done. I've worked as a server since I was 16 and eventually started bartending, but I had to take out a loan with a crazy high interest rate. Found it through Credit Karma. The company is called Upstart. I pay around $350 per month for it to this day. Personally, it was worth it to me, even though I kind of signed a deal with the devil and struggle financially every month. It was a million times worth it to be free and enjoy my 20s while I have them. I was and still am uninsured.
Story 14.
My case is extremely specific. Due to a botched surgery, it was deemed medically necessary to give me top surgery to help with the resulting chronic pain. Insurance says they'll cover it in full. I've been counting my blessings every day, honestly, and I'm not a religious guy. Now they just have to actually schedule my top surgery date.
Story 15.
I was lucky enough to have it covered by insurance and to live in an area with multiple great surgeons who work with insurance, which is most surgeons anyway in Germany. I informed my workplace that I'd be in the hospital for surgery and absent for approximately 3 weeks. We have paid sick leave here, so work wasn't an issue. For getting me in and out of the hospital, I enlisted a friend to drive me, which worked out even though it was quite spontaneous.
Story 16.
I'm so sorry if this is unwarranted. I'm in my mid-20s and still haven't gotten top surgery, but I've had a few friends who, through their employers, and by getting onto their employer's health insurance, were able to have their top surgery completely or mostly covered. They didn't have to pay much, if anything, out of pocket as long as they met additional criteria. Starbucks was one of the companies they worked for, but I'm not sure if things have changed over the last few years. The employer's health insurance policy was more flexible, and I think there was something along the lines where they still covered it even if the surgeon didn't accept insurance. I'm sorry, I can't remember more. Sadly, it's not the health insurance that's the problem here. I have great insurance and great coverage for TransCare in all regards. However, it's this damn surgeon. He's a plastic surgeon, so I guess I get it. But he's the only one who does top surgery in the area. Ugh.
Story 17.
I got top surgery on April 11th, 2019, when I was 20 years old. I went to a local surgeon who operated privately and didn't accept insurance. The cost was $6,900 for a double incision with nipple grafts. I was lucky to have a supportive family who helped with crowdfunding. I personally saved about $3,000 from working and doing art commissions on the side, and the rest came from crowdfunding. I also offered gifts and small commissions to the people who donated, which created more incentive and interest. That helped a ton, but was a lot of work and caused me significant stress. My father also took out a loan of about $1,000, which I paid back over time. I highly recommend seeing if a family member can take out a smaller loan you can repay. Also, if possible, ask to be a co-signer to help build your credit. It's not easy, but there are ways to make it happen. I was privileged to have help, but I think I could have saved the rest within another year or two.
Story 18.
Okay, so I'm not in my 20s, but I just had top surgery and faced transportation challenges due to my car breaking down. Here's what I did. Check with your insurance to see if they offer transportation assistance. Some insurance plans provide ride services specifically for getting to and from medical appointments, including surgeries. Look into local cab companies. Some offer flat rates for medical-related trips, even to out-of-town locations. Reach out to your community. I made a shout-out on Facebook and found a neighbor who's a big trans ally. She helped drive me to my surgery and follow-up appointments for just the cost of gas and lunch. It sounds like you've done your research on getting the surgery itself covered. So now I'd focus on transportation. Definitely check with your insurance for possible options.
Story 19.
I'm 40, but when it comes to savings, I now have less than I did in my 20s. My health is poor, so I can't work much, and my pay is low. On top of that, I have a severely handicapped child. Luckily, I live in Europe, where most of the cost of top surgery is covered. I feel guilty that I can afford it easily, even with my tough circumstances, while others struggle so much. If I were rich, I'd help all trans people who have financial barriers to accessing treatment and surgery. To save money, I've made significant lifestyle changes. Cut cable TV and got rid of my car. Installed a rainwater container to reduce water bills. Reduced household appliances to the bare essentials. Serve cheap meals like omelets and buy in bulk to save money. Recycle bath water for flushing toilets and shred garbage to reduce disposal costs. By cutting costs, I save about 10% of my salary each month. During COVID, I relied on my parents' help, but now I'm on my own. I can still use their car when needed, which helps. If you can, look for support from family or friends, or consider crowdfunding. I truly hope you get there. I feel so lucky to live in a country where Social Security covers most healthcare costs. But it breaks my heart knowing it's not the same for everyone.
Story 20.
My twins set up a GoFundMe for my top surgery. Mostly friends and family donated, and I saved and paid for a third of it myself. I work as a line cook, so I don't make big money. I got my surgery when I was 21, and I'm 22 now.
Story 21.
26. Haven't had it yet. I work a low-income job with no help from my parents. I haven't asked for help because I don't like receiving it from them, and I've been living on my own in another state for several years now. I might try saving up to explore my options when I either get my employer's health insurance or insurance from the marketplace. However, saving is almost impossible. Alternatively, I've wanted to move to Japan for a long time, and I might consider transitioning there instead. They have much more affordable healthcare, and their society is relatively accepting of trans and gender non-conforming people, at least in the cities. So, I might save up to move abroad instead.
Story 22.
In Sweden, gender-affirming surgery isn't covered unless it's done through state hospitals, which involves years of waiting. I had mine privately at 20, I'm 23 now, and paid out of pocket. Thankfully, my mom saved a bit of money for me every month since I was born, and I received it when I turned 18. Additionally, I received 2 insurance payouts, one for my disability and mental health struggles, and the other for self-harm scars. These were intended to cover financial burdens and treatment costs. It wasn't rich money, but for an unemployed, disabled, trans teen student, it was life-changing. I was able to pay for surgery, study abroad, pay rent during unemployment, and even make a down payment on my apartment. All thanks to my once transphobic mom, who pushed me to get diagnosed, not because I was trans, but because she thought I was disabled. So thanks, Mom. You weren't entirely wrong.
Story 23.
I'm German and had insurance that covered the surgery once approved. I had the money on hand, but only because I inherited it, hence the bittersweet lucky.
Story 24.
My mom paid for my surgery on the condition I use her colleague, a plastic surgeon, even though he didn't accept our insurance. Regardless, I'm happy with the results, though I do need a revision for dog ears.
Story 25.
My dad works in hospital administration, so we have excellent insurance.
Story 26.
I have no student debt, and I worked at a famous restaurant during peak seasons, earning $2,000 to $3,000 weekly. Without that job, surgery would have been out of reach.
Story 27.
Medicaid unexpectedly covered my surgery. I was saving up from work while living with my parents, but this made things easier.
Story 28.
I used my vet school loan to fund my hysterectomy in 2020. I saved $7,500 from that loan for the surgery.
Story 29.
I work at Amazon. They have several insurance plans to choose from in my state, all of which are pretty good, but I chose a standard copay plan with no deductible. Also opened an FSA. My insurance is covering top surgery 100%. I used my FSA to pay for healthcare throughout the year and to pay the $500 scheduling deposit. I'm also having body contouring done, and since my FSA is all used up, underestimated my expenses last year. I'm financing that. It isn't covered. If I could go back and do it differently, I would probably choose the same insurance plan but put more in my FSA so that I would only have to finance part of the body contouring.
Story 30.
Still saving and not sure how much insurance will pay yet / what my out-of-pocket will be, but I'm lucky to still be living with my parents, even if they're not supportive and won't help pay, but been saving money over 4 years working a job that doesn't pay well. To be honest, I could have had more by now if I was smarter my money, but hopefully I have enough by end of February.
Story 31.
Community college, being on my parents' insurance, supportive parents, living at home, working part-time, lots of luck. It's not fair. I'm sorry, man.
Story 32.
Insurance plus I live in an area with multiple surgeons, so I didn't travel far.
Story 33.
I got it completely covered by my insurance. I had state insurance at the time and had saved just enough money for 2 weeks of recovery before going back to work. I should have had more saved up, but I snagged a last-minute opening.
Story 34.
My insurance, provided by the state, covers it if my doctor writes them enough letters.
Story 35.
I have insurance through my college and worked over the summer to pay off the balance.
Story 36.
I got mine done at 18 through a mix of savings for the out-of-pocket costs, roughly $3,000, I think. I got liposuction, so it was an extra cost, and insurance. I had to travel for my surgeon, as, like you, there was no one viable in the area. Unfortunately, I'd figure out some way to travel and have someone drive you. Even though I had to travel, I had my surgery around 5 a.m. and woke up, went back home around noon. We were lucky enough to find a cheap B&B nearby to stay for the night before, but honestly, we could have done without it. The drive home, I faded in and out between sleeping and sluggish awareness. LOL. Planning and saving is your friend. I was lucky enough to have a supportive job even as a part-time employee. It might be expensive, but if you can't find someone to drive you that you know, Uber, Lyft / local taxis can drive you long distances if needed. If you can't travel because of other means, I don't have a solution for you. I'm sorry. The surgery itself was a breeze, but getting there was like trying to run a marathon through an oil slick. LOL.
Story 37.
Ontario does have coverage, but the wait is very long versus out-of-pocket. I don't know anyone who got it done in their late 30s though.
Story 38.
Insurance covered mine 100%. Unfortunately, if your surgeon will not work with insurance, then you're kinda just SOL. I know you said you couldn't travel, but have you looked at a surgeon in another city? If you're on the border of a state, maybe in another state.
Story 39.
Canadian here. My entire surgery was covered by insurance. On paper, I technically received a double mastectomy as opposed to a cosmetic procedure. I'm purposefully keeping F on my health record to avoid possible insurance issues. I have a male legal name, and gender dysphoria was listed under the relevant diagnosis list. I was surprised it was all covered, but in theory, it does make sense that it was, so hooray.
Story 40.
I'm getting mine free through Canadian healthcare. I'm getting top surgery through TransCare, which I got connected to through a youth 13 to 25 program called Foundry. Because I'm fat, they charge $1,500 for lipo on the sides, but I don't know if I want to do that all in one go. I got a lot of fat.
Story 41.
I worked, used some of my student finance, and had £1,800 in a CTF. I ended up with £3,000 over what I needed.
Story 42.
Insurance too. As for funds outside of the surgery that the insurance doesn't cover, I'll use my own money, transportation, hospital stay.
Story 43.
I am in the UK, so the process might be different, but I saved up for a deposit, then got medical finance, and I pay £170 per month for 5 years. I drove myself down, and my big cousin drove me back. The drive is around 5 hours. If you can, maybe look at a bank loan and pay it back monthly.
Story 43.
Insurance wouldn't cover it. So I saved everything I could from age 16 to 22, working my ass off at multiple jobs. I got about $500 from a GoFundMe. I was very lucky not to be paying rent, living with parents, and my student loans didn't come back into repayment until this month because of the pandemic. Very specific circumstances. But I never thought I would be able to afford it until the day I booked the surgery.
Story 45.
I am getting it free on the NHS in the UK. The downside is I've been waiting about 7 years at this point.
Story 46.
I live in New Zealand and am on the public waiting list for top surgery. I believe even then I may have to pay some amount, potentially a couple thousand NZD, which I'll happily take some kind of loan to afford. The issue is the wait time isn't first in, first out. It's luck of the draw. I might be waiting for 2 months or 2 years.
Story 47.
I live in a country with universal healthcare. Gender-affirming care is 100% covered. I haven't had it yet, but most trans healthcare is covered by insurance. I'm in the Netherlands, by the way.
Story 48.
I didn't read through all the comments, so someone else may have mentioned this already, but Google for transgender financial grants or surgery grants. There are a lot of organizations out there that will help with surgery costs and other financial help. You might find one that will help with surgery costs, or one that will help with travel expenses to rent a car and get a hotel to travel to a surgeon covered by your insurance. Insurance did cover mine, but I've searched before to see what help is out there for us. There's also grants to help pay for name change costs, binders, etc.
Story 49.
I got it about 3 weeks ago at 18. I dropped out of school a few years ago and started working almost immediately after. I didn't buy a car and walked to work to not buy gas. I saved all my money and was extremely frugal. I still bought everything for myself except groceries, which I then bought after I turned 18. I started working full-time hours about 9 months ago but was working upwards of 20 hours a week before that. It's just me and my mom at home, and while we aren't destitute, we certainly don't have much to spare, so I'm definitely not someone that had much financial help for my family. Because of how much I saved, I'm also able to pay for one of 2 courses I need in TAFE, Australian tertiary education that's not quite university.
Story 50.
I live in country with free healthcare, but very bad trans and queer rights and safety sadly. So it was free for me. I had top surgery month after I was 18. You need parents' agreement before 18. But some of my friends either had GoFundMe things, sold art, or had their parents pay for it. Why can't you travel for top surgery? Would not that be cheaper, that top surgery without insurance?
Story 51.
There isn't such a thing as insurance in my country, so I just saved up from working.
Story 52.
Just got top surgery yesterday at 18. I had been saving up since 12 and had the benefit of it being near me, so all I had to pay for was 20% of my surgery. I will say, see if your insurance has out-of-network benefits. It may be that it's 100% covered with an in-network doctor, but only 60% covered on an out-of-network doctor.
Story 53.
It's like buying a car. You have to budget and save. Just because you can't save a lot doesn't mean you can't save any. When you get taxes back, put that away. $5 here or there makes a difference.
Story 54.
Well, in New York, if you're broke enough, you can get Medicaid. That's what paid for my surgery. I think the only thing I paid for was gauze for my drain holes. Based on what I've seen, traveling is the second largest expense. You could always look into financial assistance from community organizations. I think there is one place here in the States that will transport patients pro bono for gender affirmation, though I forgot where they are.
Story 55.
I'm 24 and plan to use some of my student loan, I'm in the UK, combined with the little savings I currently have. Gonna have to wait another year or two to have enough loan set aside, and I'll be paying it off the rest of my life, but it's the only way I'll ever afford it. I could wait almost a decade on the NHS, but I don't think I could last that long, ESP, given how bad a state the NHS is in right now. They've already removed fallow from it, so not looking promising.
Story 56.
I'm 23, I get top tomorrow. I used insurance from my work and pay the extra. I owe with the money from my check.
Story 57.
A very good insurance and Medicaid, to be honest. Only paid the $100, so for co-payment. Probs wouldn't have had to if I showed my Medicaid card then, and got them off. Go for surgery at the end of the year as well, so more of your deductible had been met.
Story 58.
My surgeon stopped accepting my surgery. My insurance would have covered it too, so I was sad. But I chose him anyways because he was cheaper, great results, and I was super lucky that he was 30 minutes away, and me, my family, and my friends drive that distance pretty regularly. But I've been saving since I got a job, for 0.5 years. Now, I wasn't saving for top surgery in particular, but I did save just to have emergency money, get a newer car, any possible hospital bills, etc., and I also did the math, for school at the time, that I would save $7.8K a year, which would cover one semester if needed. Thank goodness for very high grants that school was basically free. So I never had to touch my savings, and for reference I started working almost 40 hours per week, if not more, in retail. The store was losing employees, so I had to work almost every day, making $10 to $12 per hour. I got raises during the year, and was also very lucky to still live at home rent/bill free, so my income was purely for fun and to pay for gas/car stuff/doctor's appointment, etc. I also saved some extra money in cash that didn't count towards my saving on the off chance I needed cash, almost $2,000, and I put all of that towards my surgery as well. And disclaimer, I started saving more in cash once I realized I wanted top surgery, so I stopped going out and just saved as much as I could, which was roughly 3 to 4 months of purely saving and eating almost nothing but ramen/pasta, because I also didn't want the surgery to eat up any more than half my savings.
Story 59.
I'm on the UK. Insurance isn't a thing, and the NHS really isn't good because of lack of funding. I can't afford it and probably won't be able to.
Story 60.
I'm 22 and can't afford it at all, unfortunately. I'm not sure how to start. Not sure if I'll ever afford it, and not able to travel outside my city at all, especially out of state. Was going to open a GoFundMe? Maybe just also save up in the meantime. I have absolutely no insurance at all, so it'll be tough.
Story 61.
Honestly, it's all because of insurance and living in a liberal state. I worked in high school and saved enough to cover costs on my own. My parents completely switched sides and helped me with any extra costs once I turned 18, but my insurance covered all of surgery. The hardest part was paying for a place to stay because I moved out of my house once I went to college.
The privilege of living with family rent-free really helped this be possible for me. I paid out of pocket because my insurance is TransCare exclusive. I was working 2 jobs for 1.5 to 2 years, basically full-time at each. I was really careful with spending money, which it could have went faster if I spent the whole time sober, not drinking or smoking, which the last many months, since personally, I spent a lot of money on weed or alcohol, or food/other decisions made while intoxicated.
Story 62.
I'm on my mom's insurance still, and she works for the state, so I should be all good.
I'm gonna call and make sure, but yeah.
Story 63.
Talk with your insurance to see if they could compensate you. A lot of insurance companies can work with you if there is not a reasonable provider that accepts them. You might not get the entire coverage, but it would certainly help.
Story 64.
I had a tumor and got it covered as preventative care since the kind of tumor I had is known to grow back every few years.
Story 65.
It's definitely not a normal circumstance or a hack, but it's what happened.
Story 66.
I had a unique situation. I was able to save half of it from working and the other half from live streaming and doing commissions. Had a huge live stream nearly every day, just drawing, chatting, and doing interviews with friends. I had a lot of support, so I know this isn't for everyone.
Story 67.
I live in a country with universal healthcare, Canada, and my province of Ontario Health Insurance, OHIP, covers gender-affirming care.
Story 68.
Saved money from COVID plus tax returns. Worked overtime. Found a government job that provides awesome insurance. I worked hard to get here. Served in the military, networked civilian jobs, didn't take no for answer. Worked really hard on my resume so I could eventually get a good job with nice insurance. Live in a place with a cheaper cost of living. Made an Amazon wish list of things I'd need post-op and posted it online so friends could buy something if they wanted. Literally anything helped. And to my surprise, friends did purchase stuff for me. I created the list a year in advance and shared it off and on.
Story 69.
I live in a state that has excellent Medicaid coverage. I kept a shitty job longer than I wanted so that it would let me qualify, and my entire surgery was covered through that.
Story 70. My dad died when I was young. He left me money that I had saved. Despite that, I was still on my mother's insurance. She had federal insurance for being a government worker. I had to provide one therapy letter, and they covered 90% of the surgery. I paid the rest in cash for my savings. Story 71.
Fighting with insurance for 4 years.
Story 72.
I had top surgery at 19 and paid completely out of pocket, 11,000 Canadian dollars. During my last 2 years of high school I worked almost full-time and was able to save up enough money for the surgery as well as some for school, since I lived with my parents at the time and had no extra expenses.
Story 73.
By living in Europe and getting free healthcare.
Story 74.
I started a GoFundMe, sold pronoun pins I made myself. My sibling helped set up multiple house shows where we asked people to donate. I still can't believe I saved up enough to pay out of pocket. Insurance called it a cosmetic.
Story 75.
Took a year out before uni and worked an engineering placement, my field. Saved about 5K. Will be working for them every summer, staying at my boyfriend's parents' house, and will be able to afford it in 1 to 2 years.
I have found a surgeon through my insurance. Some surgeons don't formally take insurance, but work with them. One surgeon in my area does reimbursements with a particular insurance company, so you'd be covered under them. Some surgeons are contracted this way.
Story 76.
I moved to MN, got on Medicaid, and my partner took care of post-op. To move to MN, I worked extra hours and put all my shit in a U-Haul. Stayed on a friend's couch for a few weeks with my partner, and then when we had our first paychecks, we found a place on Craigslist.
Story 77.
I've been living in my car for the past few months to afford it. So whatever money I would normally pay towards rent has been going straight into my top surgery savings.
Story 78.
I'm not 18 yet, but I'm going to get a job fairly soon, and if it all works out, I'll be able to afford it by then.
Story 79.
I got top surgery while I was in grad school and paid for it with student loans. When I tell people this, they often assumed that there was some kind of shenanigans involved, but you can use student loans to pay for any kind of living expense that you have, including medical expenses. If you try this while you're in undergrad, you may have to prove that you're not getting any support from your parents to get the amount that you need, but if you apply for loans when you're in grad school, they just assume that you're not.
Story 80.
I crowdfunded about half of it, saved up the other half working. Took a little while and I was just hit with a surprise anesthesia bill, but we got there.
Story 81.
Took me several years of saving. I was on T for nearly 5 years before I had top surgery.
Story 82.
This was not the reason I did AmeriCorps, but definitely a perk. I served 2 years, and because I was earning only $16K a year during my service, I qualified for Medicaid.
Story 83.
I don't know if it varies by state, but my top surgery was free.
Why can't you travel? If your insurance would cover the cost and it's a matter of money, I'd say save for that. My insurance covered everything except deductible, and I paid $2,500 with the stimulus from COVID.
Story 84.
Not really advice, of course, but when my grandma passed away, she left me some inheritance. I had 2 full weeks of sick time banked up at work, and between the two, and considering I was able to stay with family instead of getting a hotel near my surgeon, I was able to make it work. Essentially, I got lucky.
Story 85.
I worked more than 40 plus hours a week doing some of the crappiest jobs out there before I had the 5K needed for surgery, after saving for 5 years paid for it at 21. It's not ideal for anyone, but it was done and I don't regret any of it.
Story 86.
I got mine when I was 18 only because I had been working with gender specialists through medical, so I just ended up getting insanely lucky with already being connected with them before turning 18.
Story 87.
Care credit.
Story 88.
I paid it off over time.
Story 89.
OHP covers it here in Oregon, but there's a catch. They'll probably decline you over and over. Thankfully they also cover gender specialists, or whatever the exact job title is, so I have documentation to show the severity of gender dysphoria and increase my chances of getting coverage approved. Plus therapy records too. I don't know the chances for people using Planned Parenthood since I've never used them and don't know how or if they keep records. OHP is known for declining those surgeries without documentation since they seem to be more likely to approve people at a higher risk of taking their life and under more severe mental health impacts due to gender dysphoria. I don't know the exact rules on it, so I'm speaking from experiences and discussions from other trans men using OHP for hormones and surgeries. But I have one huge struggle: 0 doctors who do that in my areas. I have to travel 2.5 to 3 hours each way for my gender specialist in Beaverton, Oregon. We don't even have a hospital or clinic or urgent care in this town. I don't know where I can go for my surgery yet, but I hope it's Portland or Beaverton since they are the closest hospitals who have doctors who do those surgeries. The hospital in the city next to us doesn't. Also, I can't pay for it because SSI sets a $2,000 limit on all money you have at one time. I can't legally have over $2,000 for any reason. Yes, they seriously force us, disabled people, to stay in poverty.
Story 90.
I had surgery at 23, largely in part to my parents still having me on their insurance. My total surgery cost was about $1,700 for what I couldn't cover on my own despite saving. Living damn near paycheck to paycheck. I got help from my community, friends, partner, and family. I had a GoFundMe, and my job at the time allowed me to go on temporary medical leave. 1.5 years post-op, I'm still paying off the last bit of an extra anesthesia bill I didn't expect, complications, had to go back under. But overall, I'm wildly lucky and privileged to have gotten it when and how I did.
Story 91.
Just had surgery at 23. The surgeon I went with did not accept insurance, so I paid out of pocket after about 3 or 4 years of saving. Also used my care credit card for the anesthesia. I would suggest insurance if you can, however.
Story 92.
Insurance through my job. Not doing anything more than $50 per mo. For fun, that I don't, plus working 60 hours per GFM, and as many side gigs as I can physically and emotionally handle.
Story 93.
I moved overseas with me family, military, and when my parents sold their house they used some of the money to pay for the surgery for me. We didn't use insurance at all. After being denied by them 5 to 6 times, we gave up on them. I was 19 when I got my surgery.
Story 94.
I'm 18 and just got top surgery in May. I'm quite lucky because I was living with my boyfriend and his mum, and we didn't have to pay anywhere near as much in rent and bills as most do. As soon as I turned 16, I dropped out for school and got a full-time job working 40 to 50 hours a week and saved every penny I could for 2 years, so yeah, to be honest, a bit of a lucky situation on my behalf.
Story 95.
Insurance, and I had raised money in a GoFundMe. Plus, I was leaving a job at the time and cashed out my 401k that accumulated.
Story 96.
I had been saving for years while waiting tables, had 3 roommates, and stashed my stimulus checks.
It was truly that and luck. If I were to try and get top surgery now, no way would it happen on my income and living situation LMFAO.
Story 97.
According to my GP, a lot of guys in the UK will take out loans to get it and pay it off over however long they need. Ick the process, but it's something I want to look into once I've paid off my overdraft LO.
Story 98.
I had TS in my 30s, but it cost me under $3,000 at a top surgeon. I have good insurance through my good job though. I live in California and insurance covered most of it. Many/most surgeons, Reed, the top ones, in Cali work with insurance. Also, I heard if you're on the public healthcare option of LA Care, they cover fully. A lot of trans healthcare surgeries even beyond TS. This makes trans care accessible for PPL without a fancy job. But I've only heard that through the grapevine, so don't quote me.
Story 99.
Medicaid and or Medicare pays for here in Cleveland, Ohio. The Superior Cleveland.
Story 100.
I worked at a factory for a year while living with my grandma rent free and saved up all my money at 19.
Story 101.
Using all my money towards it even if I starved to death, LOL.
Story 102.
In my case, I was living at home with unsupportive parents at the time. I saved 50% of every paycheck I made for 5 years. I worked a few different jobs, all which paid me at various numbers under $13 per hour, until I had enough to begin the top surgery process. A GoFundMe helped me with the rest of the way. I paid for my surgery out of pocket, and my surgeon was local.
Story 103.
Went to Mexico and paid cash.
Story 104.
Started working at 16, put away lots into my savings, and I chose not to drive and to live at home in favor of being able to afford surgery. My surgeon had many different finance options in order to pay it back over time instead of all at once, so I gave them a deposit I could afford and then paid the rest back over 12 months.
Story 105.
Insurance. I got my top surgery about 3 weeks before turning 20, and while it was still a few $1,000s, my wonderful university insurance allowed for a $5,000 out-of-pocket maximum and covered 80% of basically everything once I'd already hit my deductible, which I had.
Story 106.
In my province it's free, but it costs an additional $2,000, I believe, if you want chest contouring as well. I got a bit lucky, because I went with a fairly new surgeon at the clinic, so she had a shorter wait list. I got mine within 2 months of having my consult.
Story 107.
I'm getting top surgery at 17. I live in New York, so my insurance is covering it, and I have another consult tomorrow. The other surgeon was creepy.
Story 108.
The surgeon that did my procedure accepted my insurance, and it was fully covered. I even got liposuction for a more masculine contour.
Story 109.
I got mine when I was 20 and thankfully my insurance covered most of it. I got most of my money from working and then a GoFundMe. I got my surgery in 2021 and I'm still paying off some of the hospital bills with a monthly plan.
Story 110.
If my insurance doesn't cover it, I plan on taking out a loan. It would take years to save enough for it, if I ever could, but I can do monthly payments.
Story 111.
I work my ass off. I get surgery in December. I'm also going to Poland, where it's like 3x cheaper. But yeah, I do construction testing stuff about 50 hours a week, and I'm a full-time engineering student. I'm able to put about $1,000 a month in savings. However, I also spend very little money on anything, just rent, food, gas, car insurance, utilities, and that's it.
Story 112.
Saving up RN. It is fucking hard, but all I can do is save up and wait.
I saved every penny, sold stuff I didn't use, did some dog sitting, walked some dogs, invested money, high-interest savings accounts, mkney I would spend on a drink out or a new game ID put away instead. ID buy cheaper options in general. Shopped around for surgeons and prices. Cheaper isn't always better as I learned, but it be what it be.
Story 113.
I'm 17, but I'm paying for my own top surgery, and for me it's insurance. The copay is only $150, so it's doable.
Story 114.
Work for Amazon cost me $300 with their insurance.
Story 115.
Medicaid. Paid for my whole surgery. I paid $4.
Story 116.
I live in Colorado though, where Medicaid covers gender-affirming care.
Story 117.
I started saving money at 13 when I knew I wanted top surgery. I saved so much like the world is gonna end if I don't have top surgery cause I was in a bad place during those years. 13 to 16, hating binders and my chest. Lunch money was cut, allowance was cut, earn some side income whenever possible like the semester breaks, save on costs and spending. Spending money was pre-planned, especially big amounts. Went to a cheap surgeon who was also the country's top 3 surgeons for top surgery for trans men. Maybe being transmasc and choosing not to have nipples reduced the cost a little. Estimate $13,000, mine ended up being $12,000 compared to others who went for the same doctor. We had our own community-reliant chat for transmascs in the country. I saved $20,000 and paid $12,000 for my surgery, was very worth it. By the way, some docs who have lower experience will lengthen the time in surgery operation to maximize their wages. FYI/ just so you know.
Story 118.
Somewhat random, but I have an inherited gene that leads to a very high chance of breast cancer, BRCA2. So insurance covered it as a preventative measure. And I got to talk with the plastic surgeon about how I wanted it closed.
Story 119.
In my case, when I do go for top, it'll be covered by Indian Affairs as gender-affirming care. So I am extremely fortunate for my treaty rights edit to add I am Canadian and Treaty First Nations.
Story 120.
Was granted some miracle inheritance from someone I hardly knew as a child. Do not know if I would have been able to get it otherwise. Mine was free with my poor people insurance, Medicaid, year before my insurance was able to cover it.
Story 121.
I was 19 when I got it by working 2 jobs while in college after aging out of foster care. There comes a point in your life where you just won't accept no for an answer. And I wasn't handed anything in life and no one is going to give you a damn thing. No insurance and no family. The minute we stop making excuses in life, not saying you are, is the minute things actually change, but the internal change is way bigger than the actually external change. Good luck to you. I had top surgery at 22 or 23, I'm 25 now, insurance paid for it.
Story 122.
Currently working with nothing much in my pockets, since most of my month's pay goes to college, but the top surgeon I'm scheduling with had financial options where I put a down payment and pay it off monthly. Try looking into one of those. My insurance won't cover jack, so this is what I am resorting to.
Story 123.
23. Insurance is covering all but just under $3,000. I'll probably going to get a payment plan with the hospital afterwards. If not, maybe Care Credit or something. Haven't had it yet, but it's in less than a month.
Story 124.
I'm in my late 20s and am on Medicaid. My insurance is covering the surgery. I'm in New York, so insurance is legally required to cover gender-affirming care, with some exceptions.
Story 125.
I'm in Canada, so I'm able to get it for free through the Provincial Transcare program, which I'm so lucky to have access to.
Story 126.
I had some savings from my half of mine and my ex's joint account after he left me. Very few expenses because I was living with my parents. And extra income from all of the mandatory overtime at work. 14 hours overtime per week. Went to a cheap but good surgeon. It cleaned me out, especially since I quit the job and got another that paid less and had fewer hours when I went back to school, but I was able to do it.
Story 127.
I'm not saying this in a gloating way, mostly just don't want folks to feel bad about not being able to afford it and assuming that a lot of PPL are paying out of pocket. Get Medicaid if you can. I live in California and have medical. It fully covers the top surgery, testosterone treatment, and all of my doctor's visits. I genuinely can say that gender-affirming care is saving my life. I understand though that I am incredibly privileged to be using this and still being able to afford the cost of living. I work in film, freelance, so it's definitely a trade of making very little money, but having this has been incredibly helpful.
Story 128.
Save and save and save and save. My surgery was about $7,000 out of pocket, no insurance, and I have yet to pay for my revision I plan to have later this year. I've been working on and off from pretty much as soon as I legally could. My first real consistent job started at 17 and 3 years later I was able to get my surgery at the cost of half of my bank account. Keep in mind I also pay for my daily utilities, groceries, etc., and also had to pay for solo recovery costs. It's definitely possible, you just have to stay consistently minded.